That's exactly what happened to the woman they call the Coffee Lady. Here's KARE 11's John Croman.
In December, a surgical team spent many hours hovering over the face of a cancer patient named Laura Kabelnik. They had two missions: to stop the spread of a disease and give her a chance to use her tongue again.
The resection, the removal of the tissue, is to save her life and to get the cancer out of there. The reconstruction gives her best rehabilitation.
The woman on that table was no stranger. I've known her for years, as have many visitors to the Science Museum, as Laura the Coffee Lady, the smiling face at the stand in the lobby run by a private vendor. It's an easy walk for Laura from her St. Paul apartment down Kellogg Boulevard, which is good because she doesn't have a car. She also relied on foot power to get her to the Ordway Theater, where she worked as an usher. The two part-time gigs paid the bills, but not enough for her to buy health insurance. Laura did not like being uninsured, but she'd never been sick. In fact, she'd never even been to a hospital. And she assumed that if her life were ever on the line, some safety net would kick in. But that is not how it played out last September when she found a lump on her tongue.
It's hard to take in. You're healthy all your life, and then all of a sudden, three appointments later, and you have cancer, and lose half your tongue, and Lord knows what else.
Her dentist sent her to an oral surgeon, who sent her to a specialist in downtown St. Paul, who demanded money up front for a biopsy and diagnosis. It cost her $450 she didn't have.
So to find out if you had cancer, you had to pay
on my credit card.
$450 on your credit card.
Right.
You might guess surgery would be the next stop, but not so for an uninsured woman with no experience navigating the public health system.
So his nurse was on the phone with you saying, this needs to wait.
Right, because, it being so expensive and all, but still, when you find out you have something like that, you want to get going. Let's take care of this.
The doctor's office directed Laura to Ramsey County Social Services to apply for state medical assistance and told her that once that kicked in, her cancer treatment could begin.
And I said, well, can't we just get going and I'll pay it as I can as we go? And they were very nice, but she said, well, that's going to be thousands and thousands of dollars, we better wait.
Here at the Ramsey County offices, it became a game of eligibility algebra for Laura. Her two part-time jobs put her over the limit for GAMC, and because she's single and has no kids, she couldn't qualify for Medicaid. So she pinned her hopes on Minnesota Care, which is the plan for the working poor that has a 3-month waiting period minimum. Autumn turned to winter in the capital city with no word on Minnesota Care. And just showing up at an ER wasn't an option because cancer is not considered an emergency.
What did you assume would happen to someone without insurance if they found out they had cancer?
Well, I would assume that they would be taken care of. What do I know?
Then Laura's dad learned through the Cancer Society that Hennepin County Medical Center treats uninsured people. So she called HCMC and they agreed to take her and then deal with the money questions later.
We would proudly say, and I often do, that Hennepin County Medical Center has captured the market on the uninsured because that's the role that we serve.
The operation seemed like something out of science fiction. Surgeons removed the right half of Laura's tongue to take the cancer, then borrowed skin and veins from her left arm to rebuild the missing half of her tongue. They repaired her arm with tissue from her thigh.
It gives the surgeon who's taking tissue out more comfort in saying, I can take out as much as I need to because I also have a way of replacing that tissue now.
Laura's surgeon, Robert Mizell, told us that the sooner you operate in a case like this, the better the odds of creating a fully functional tongue.
I would not want to wait very long to treat this because it might change your ability to do the treatment you're planning on. Can you wiggle your tongue?
Dr. Mizell liked what he saw when Laura returned for a checkup a month after the surgery. That tube in her nose was how she was getting her liquid diet at the time. The transition to swallowing will be gradual.
So yeah, I was scared. I was nervous. But everybody over at HCMC was great. It made me feel comfortable as I could. And they took really good care of me.
How many other Lauras are out there uninsured, hoping they won't get sick? Well, the Department of Health puts that number at 480,000 in Minnesota, or 9% of the state's population. To HCMC's medical director, it's very clear some will die from lack of coverage.
One of the myths of the uninsured is they get all the care they need. It's merely an inconvenience of needing to wait in an emergency department.
HCMC was able to convince the state's medical review team to cover Laura's surgery because she now had a disability which qualified her. But when we say cover, that's relative. The hospital billed the state $144,000. The state paid only $17,000, and the hospital has to absorb the rest. which is why caring for non-emergency patients from other counties, such as Laura from St. Paul, will be harder for Hennepin County to afford as the state dials down health spending.
I miss you guys too.
2 months after surgery, the coffee lady paid a visit to her friends at the Science Museum.
I miss you guys too. I think of them every single day, so it was really nice to come down and see some people. So good.
It turns out they miss you.
Yeah, go figure.
She vows to come back here when she's all the way well.
The doctors expect that Laura's speech will improve over the next year as her rebuilt tongue kind of stretches to full size and they replace all the teeth they had to pull for her radiation. It's important to note that Laura never asked to be on TV. That was our idea. I've been a customer of hers for years, and every time I stopped at the coffee counter last fall, there was a new twist in her story, so I asked her if she'd let us follow her. And by the way, Laura did hear back from Minnesota Care. She was accepted in that plan. That word came 4 months after she applied, 6 weeks after HCMC went ahead and operated. And there is some good news here. She doesn't have to worry about being homeless because there was a fundraiser for her in December, and people, even complete strangers, chipped in, so that's paying her rent right now.
Seems like there are a lot of people who don't even know many of these programs exist.
That's exactly true. She had no idea any of these programs are out there, so she could have probably applied for Minnesota Care before she got sick, but she didn't even know it existed.